Hi everyone, today we're going to be talking about Bulk Easy Plus Composite. So what is composite? It's a synthetic material that combines polymeric matrix with the dispersion of glass, mineral, or resin filler particles used to restore tooth structure. Complications seen with traditional composite include recurrent decay due to shrinkage, inadequate bonding to underlying dentin, which can cause chipping or breakage of the composite material, leakage of material, and mechanical failure due to forces of mastication. Ideally, a shrinkage-free composite with good wettability and compression strength is highly desired to simplify the operative technique. So what is Bulk Easy Plus? It's an easy-to-place dual-cure composite that combines flowable composite properties with high strength and wear resistance seen in packable composite. When it's initially placed, it is flowable, and once it self-cures, it acts similarly to traditional composite. The self-curing material design prevents shrinkage and allows for single-step bulk placement, which is ideal for direct restorations. Traditional composites contain large particles of silicon quartz, which give them good mechanical properties but make the surface of the restoration more likely to fail. With Bulk Easy Plus, it incorporates 80 nanometer zirconia fillers, which enhance aesthetics, shade matching, polishability. It ensures greater wear resistance, and its depth cure property eliminates micro leakage and gap formations. So major uses and importance. Shrinkage control ensures interproximal marginal integrity. It combines flowable and packable composite properties, so we see high flexibility, high strength at 138 MPa and wear resistance. It has a high radiopacity, which makes it easy to analyze on X-ray, and the unlimited depth self-curing property saves up to 60% of cure time.
So what is the significance of our product to the patient and the dentist? So as mentioned before, it has enhanced aesthetics with matching tooth color, single layer techniques, so we avoid the layering techniques, one-time curing, primers or activators are not needed, unlimited depth of cure, which is very important for posterior teeth and hard to reach areas, and delayed curing, which has an advantage for minimum polymerization and shrinking. So this is all a great recipe for less steps, less time for the patient in the chair, and more time for dentists to see other patients and greater outcome for the patient. Also, according to some clinical evaluations, dentists mentioned that it was their go-to product in deep interproximal restorations and root caries, both of which are hard to isolate.
So in order to thoroughly discuss Bulk Easy Plus, we have to consider the important factors and instructions to follow when using it. Bulk Easy Plus, as mentioned, behaves similar to a flowable composite, and it comes in an auto mix syringe. For the syringe, there are two different tips, 17 and 19 gauge. A 19 gauge works better for more conservative restorations, while the 17 gauge works better for larger restorations. These mixing tips are single use and they are provided non-sterile. The mixing tips must not be reused, and a barrier sleeve should be used to cover the syringe in order to avoid cross-contamination between patients. Bulk Easy Plus is compatible with a wide variety of methacrylate-based dental bonding agents and systems, as well as etching systems or techniques without the use of a dual cure activator or primer. It is important to ensure the time is taken for the delayed polymerization. Similar to any resin composite material, once the Bulk Easy Plus is placed into a preparation, there is some time to manipulate and shape it. However, with other resin composites, once you've shaped it to where you want, you would light cure it immediately. This is not the process for Bulk Easy Plus. Once placed into the preparation, you must wait 90 seconds before you light cure if you choose to do so. This delay in polymerization is what helps keep polymerization shrinkage and the microgaps to a minimum. When it comes to light curing, if you choose to do so, a halogen curing light with a minimum output of 600 milliwatts per centimeter squared should be used. Other light sources or intensities require an adjustment to this cure time. The material should be stored and used at room temperature for the best outcome, and it is recommended to leave the bulk Easy Plus mixing tip on the syringe as a cap until your next application.
Two of Bulk Easy Plus's competitive products are Sure SDR Flow Plus and Sonic Fill 3. Sure Fill SDR Flow Plus is a self-leveling bulk fill composite that's applied in one step. It has a low viscosity, which allows it to adapt to cavity walls and flow into tight spaces. Sonic Fill 3 acts as a flowable, sculptable composite, and it requires a special handpiece, and it's also a one-step placement. So all three of these are composites that are placed in one step and are easy to use. They're used for various restorations, and the price is similar for all three of these products. However, Sonic Fill has initial higher cost due to the special handpiece that's required. Comparing these products, Bulk Easy Plus has a much higher degree of conversion, which leads to a greater depth of cure. Bulk Easy Plus also offers greater glossiness, polish retention, and wear resistance, and it eliminates micro leakage, which makes it so it doesn't shrink in response to light curing.
Okay, so to wrap everything up, as we discussed, we are looking for a new composite to begin using in our practice. Traditional composites do have an issue with shrinkage, limited bond strength with natural tooth structure and the composite itself, and wear and tear during mastication and usage. We propose to begin the use of Bulk Easy Plus to combat these issues seen in traditional composites. As we discussed earlier, Bulk Easy Plus has many benefits as it is a dual cure system. This allows us greater depths of curing, especially with extensive restorations. This can help our patients so they don't necessarily have to splurge on a crown. If a composite is able to This can help our patients so they don't necessarily have to splurge on a crown if a composite material like Bulk Easy Plus is able to withstand the strength from mastication and seal those deep restorations, preventing secondary caries. With the tip, Bulk Easy Plus is able to combine the placement of a flowable composite along with the properties of a packable. This allows deep placement as it cures, and its in-depth curing prevents breakage. The addition of the zirconia filler improves bending strength, Vickers hardness, and the translucency of the dental composites. This allows us to create better, more natural restorations while also taking into account great strain and usage, again, during mastication and occlusion. Because of this, we recommend the usage of Bulk Easy Plus at our practice and believe that both patients and the providers will benefit greatly. And here are our recommendations, our references. Thank you so much for listening.